Please, I'm here to order me around for this.
It's good. I think there's a little bit of room for the speakers to move in. It's nice. Lucy, when you are ready.
Okay. All right. All right, can I hear a Happy Mother's Day, Pittsburgh?
Happy Mother's Day, Pittsburgh!
One more time.
Happy Mother's Day, Pittsburgh!
All right, thank you guys, everyone, for being here today, our community allies, our elected leaders. My name is Lucy Rose Ruscio. I'm a nurse practitioner in the neonatal intensive care unit at Magee Women's Hospital. I'm also a proud member of the SEIU Healthcare Pennsylvania, coming on a year now. And most importantly for today, I am mother to Gus and Frankie, and you can't see, but I'm also soon to be mother to a new baby girl. We have so many incredible people here with us today from across Pittsburgh and Allegheny County. We have Billy Heilman, our PFT president, who came here early to help set us. And the Pittsburgh Federation of Teachers, who are our hosts today, a huge thank you. Jen Mazzocco from PFT, she is a board member and newly elected state representative. Congratulations. We have Neil Bisnell, our SEIU executive vice president. And we have so many organizations that are here supporting paid parental leave. The Black Women for Better Education, Catapult, Greater Pittsburgh, Just Harvest, New Voices for Reproductive Justice, Pittsburgh United, Pennsylvania United, Pittsburghers for Public Transit, Women and Girls Foundation, Women's Law Project, YWCA, SEIU Local 32BJ, and SEIU Healthcare Pennsylvania. With so many people. And additionally, I'm not sure if anyone or everyone has seen this weekend's Pittsburgh Tribune, the first printed edition in over a decade. And when you see the center goal, it's just the beginning. More exciting things to come. So I think what unites us here today, this wide coalition across Pittsburgh, is really a unique combination of love for our community and outright rage at the growing crisis we are facing.
Hear, hear.
Rage and love is a combination that mothers know all too well. This is also a combination that I've witnessed for years as a bedside NICU nurse, watching parents struggle to balance the joy of childbirth, the anguish of a NICU admission, and the dread of the timeline to go back to work. I've witnessed it over and over again. Mothers who wanted to breastfeed, who needed to heal and spend time with their children, but who knew that often in as little as 2 weeks' time, their cracked, bleeding, leaking bodies would be pulled back to an office miles away. Spouses who missed out on swaddling lessons and milestones that don't come around a second time, because the economic reality was that their family could not afford to go without another paycheck. I saw this over and over again. I still do nearly every day. And I never fully understood that anguish until I became a mother myself almost 5 years ago. This need was reflected in our community survey, which had over 1,000 community responses, where 2 urgent needs really shone through. Our patients want more time with us as nurses when they're in the hospital, and they want more time to heal and to care for their newborns after they leave. In fact, 85% explicitly said they wanted more time for parental leave. These findings were enforced by a professional poll showing that 84% of likely voters in Allegheny County back paid leave. And this was strong support across party lines. This is not controversial, this is not new, and it is needed. We are here today with a simple yet profound demand. We are here to demand paid parental leave for all working families of Allegheny County. This is the urgent antidote to a maternal and infant health crisis in our community. Clinical studies prove again and again that paid parental leave reduces infant and maternal deaths, improves breastfeeding rates, improves physical and mental health of both parents and children. This is an economic issue as well. We are all suffering from the rising costs of simply existing these days. Working parents should never have to worry about losing their paycheck or even their jobs in order to take care of their babies. Additionally, companies that do offer paid parental leave for their employees have reported improved employee retention, reduced absenteeism and training costs, and boosted productivity and morale. Far from not being able to afford to have paid parental leave, it seems we can't afford not to. And UPMC certainly can afford to. Not only is today Mother's Day, it is also Nurses Week. How apt. As in addition to a maternal and infant health crisis, we are currently facing a national nursing crisis as well. And Pennsylvania has 20,000 unfilled nursing positions, which is the worst in the entire country. Is it a coincidence that Pennsylvania is also the only northeastern state to have no paid parental leave on the books? The lack of professional benefits like paid parental leave drives nurses away from the bedside and out of our profession. Currently, UPMC offers just 2 weeks of paid parental leave to us nurses at Magee. Even though we spend our careers caring for new mothers and new babies, it is the preeminent birthing hospital, and we are a majority women workforce. UPMC, as the largest private employer and healthcare corporation in the Commonwealth, which with $643 million in profits last year, has both the resources and, more importantly, the moral responsibility to lead on parental leave. Magee Nurses are so proud to be here and to help lead this coalition because we see every single day how parental leave is absolutely critical to solving the infant and maternal health crisis, as well as the nursing crisis in Pittsburgh. We are currently negotiating our first ever union contract. And we are bargaining on behalf of everyone in our community, which is why we're here today. This matters to all of us, and our united advocacy will have reverberating impacts for generations to come. Thank you all so much for spending your Mother's Day with us. It's truly an honor. And with that, I would like to invite our first speaker up. We have Ashley Commands, president of Catapult Greater Pittsburgh.
Thank you so much. Hi, my name is Ashley Comans. I am here as the board chair of Catapult Greater Pittsburgh. But I'd like to also just share after those remarks. And so one thing about my life and growing up, the testament of the hard work of nurses is truly foundational to the love and respect that I have for you all. So thank you so much for your work. And we are going to get this passed.
Absolutely.
So as I shared, Catapult Greater Pittsburgh, we are a local nonprofit focused on pulling people out of poverty and working towards economic justice. So I also want to say happy Mother's Day to all of the moms who are listening, and to also those folks who struggle on days like today, because I know that Mother's Day can bring a lot of feelings and care and grief. So there's care and love that I want to send out to everyone. And look, here comes my one. So I was looking back on some history about Mother's Day today, and from the Smithsonian of American History, this day is really rooted in the remembrance of a woman named Anne Maria Reeves Jarvis. Born in 1832, a mother of more than 6 children, and many of them passed due to illness and diphtheria, measles, things of that time. And her work on Mother's Day was rooted in supporting her community and lifting people up so that they don't have to suffer in the same way that she has. So all of us being here today, I think, is really a testament to what we're doing right now to bring paid parental leave for everyone right here in Allegheny County. So Catapult Greater Pittsburgh engages in emergency resource distribution, peer-to-peer support, wealth building, trauma-informed financial counseling, and policy advocacy to ensure systematically disenfranchised communities can meaningfully achieve economic justice and lead dignified and equitable lives. The work of our team at Catapult is truly hard. And when you are supporting people in the community who need a lot of support, a lot of your time, and a lot of your care, that also requires our own employees to be able to stand strong and support the people that they work so hard for tirelessly day to day. And something that I have been honored to watch with our organization CEO, Tammy Thompson, is that she leads her team in providing programming that has been life-changing for community members right here in Allegheny County. And a key piece to the success of that work, I think, is how it's implied internally with our own employees being able to have 12 weeks full pay, paid parental leave. I know for a lot of nonprofit organizations, and specifically those smaller ones, where we know that budgets are tight, you are depending on foundations to fund work that isn't easy. And so for our organization to be able to do that for our small team of employees and still be able to sustain the work that we are doing is just a testament to the fact that this can be done. Ironic, my mom is calling me right now. So one of our employees, Brittany, I had a conversation with her a couple weeks ago, and she was just sharing how beneficial that has been. She is a mom of 2 young kids, a 4-year-old and a 2-year-old, and her being able to take that 12 weeks of time to adjust and become a mom has truly been impactful. She said when she goes out into the community and she talks to her friends, she didn't realize that that wasn't something that everyone doesn't get a chance to have when they work for a job 40 hours plus a week. And, you know, every day of their lives is committed to that. And so what she said is, one thing about Catapult, you don't have to drag me out of here. That goes to show how you take care of your own team, your own employees, and giving them that support and security that even once they have a child, they can come back and continue to do their job while after taking care of themselves. That should just be the way that employment works. This shouldn't be a fight. This shouldn't be a conversation that we have to convince people on. And that is what I truly love about Tammy, our CEO. She says, I have a budget. I have budgeted for their salary for a full year. So if they need to take 12 weeks out, why can I not continue to use that same budget for that employee to be able to do what they need to do, take care of their families, and provide paid parental leave?
Smart.
In addition to that, there are also other conversations around sustainable wages and how you're able to actually sustain and take care of yourself, which is also just the full compass of the work of Catapult Greater Pittsburgh. But I want to leave with a message that being a part of an organization like Catapult, and I've been on this board since 2018, I have witnessed the retention of employees that have committed their time and many years to the work of this organization. And if we continue to support more families in that way, that can only benefit our organizations across this.
Thank you. With that, I want to introduce my sister today in support of parental leave for all working parents in Allegheny County. My name is Jean Stone, and I to 3 young women who I had the privilege of raising along with their
time to recover at home. 85% of people have specifically called for more paid parental leave. We can take that and make it real for the people who need it, and that's everyone. I'm a resource nurse, so I float to all our obstetric units, including postpartum. There, I see women who are readmitted to the hospital because they have complications that could have been avoided if they had more paid time off to properly care for themselves and their newborns. Giving birth puts your body through a lot of physical, mental, and emotional wear and tear. When they get home, new moms find themselves on their own, trying to care for their own worn-out bodies, their mental well-being, and their baby. Without out of control inflation, working families are worried sick about paying the bills and so force themselves to go back to work before mom or baby are ready. That takes a toll on maternal and infant health across Allegheny County, and it shows up in the data. Paid leave would be a lifeline to the hundreds of thousands of working parents in our county without adequate leave, giving them more of a financial cushion and time to get the help they desperately need. My fellow nurses and I strongly support this policy, and we pledge to work arm in arm with this coalition and our leaders on the county council to make parental leave for all a reality. Thank you.
With that, I would like to introduce new mom, Julia Menti.
Hi, thank you so much for having me here today. I wouldn't want to be anywhere else on Mother's Day other than surrounded by all of these people in our community who make me feel really cared for and supported as a new mom. I want to share a little bit of my story in the process of becoming a new mom, what that looks like financially, and also what that's looked like medically. So, first of all, when I was pregnant, I was working a job, but I didn't have any anticipation of paid leave. So instead of keep my job, I quit so that I could have my baby and take care of my baby once they were born. So that's my baby Kieran, who's over there. And when he was born, he had to spend 5 days in the NICU at Children's Hospital. He received life-saving care while he was there, and we were really lucky for him to get that care, although I'm sure everyone here knows that that care was not cheap, to the tune of about $86,000. What was really most important while Kieran was in the NICU was to have the support of the staff and also of his family while he was recovering. That's what he needed. What I needed while we were in the NICU was my husband, Matt, to wheel my wheelchair around so that I could get to the bathroom, so that I could get food. It really took our entire family to be able to focus in that moment on Kieran's care. So that's why it's a really important reality that parents need to be able to be focused, be home, be there for their kids when they are born. Also, just to talk a little bit about my experience since then, he's 11 months now, so we're going on, he's about to be a year, and he's doing great, thanks to his amazing care that he received at Children's. But I am a person who has not been able to go back to work yet, because I'm also a full-time student, and that means that I currently am living off of loans. And that is because there's just no good options for us right now to be able to both achieve my higher education that I'm seeking and have the care of my child that I need. Being able to live and piece my life together through loans and through support of family is something that is a little bit embarrassing and shameful to share. But I think it's really important that we talk about the way that parents have to financially piece together the key tools that it takes to make a healthy life. Because we all suffer from this. As has been already mentioned, we know that the cost of living is rising. The cost of healthcare, the cost of housing, the cost of being able to take care of my baby and make sure that he's fed. So we need to bring these issues into the light, and we need to find ways to support each other to make sure that we can make it through and everybody is taken care of. I am a privileged parent who's able to live in this situation with loans and be able to still get my education. But that is not the case for everybody, and we know that there is racial disparity in that ability. I want to just kind of like leave you with this one thought about my experience. I have seen that it does take a village, as they say, to raise our children. And when we think about that village, I know we think about mothers, and we think about families, and we think about the caretakers. But I also want to think about Allegheny County as that village, and the role that Allegheny should play to care for the parents and the people who are taking care of the children. And I think that this is a great first step that we can take to making sure that there's more of that care and more of that responsibility being helped in our community. Thanks.
Thank you so much for sharing that story that I think resonates with so many of us. Next, I would like to bring up my coworker, a face I'm always happy to see when I walk into the NICU, Nurse Ashley Greco. Woo!
Good afternoon. It's so inspiring to be here with all of you today and feel the united power in this room. My name is Ashley Greco, and I've been a nurse in the neonatal intensive care unit at UPMC Magee for the past 8 years. Every day I care for premature and critically ill babies, but I also care for their parents. Vulnerable parents whose worlds have been turned upside down and who are trying to hold their families together while facing fear, uncertainty, and impossible choices. One of the hardest realities I witness in the NICU is the impact of inadequate parental leave. Parents of hospitalized newborns should be focused on bonding with their babies, learning how to care for them, and being present during critical medical moments. Instead, many are forced to worry about losing income, returning to work too soon, or exhausting all of their leave and paid time off before their baby even comes home from the hospital.
Shame.
I have watched parents leave their newborn's bedside in tears because they could not afford to miss another shift at work. No family should have to choose between caring for their child and paying their bills. It's not just my patients. I also see the impact that the lack of parental leave has on my coworkers and the nursing profession as a whole. Nurses spend our careers caring for others, yet many of us do not receive the support we need when we become parents ourselves. At Magee, the preeminent women's health and birthing hospital in our region, which is incredibly profitable, nurses only get 2 weeks of paid leave. I have seen talented, experienced nurses leave bedside nursing entirely because they could not balance the demands of motherhood, recovery, childcare, and inflexible leave policies. In a profession already facing burnout and staffing shortages, inadequate parental leave pushes even more nurses out of the workforce. That hurts healthcare workers, hospitals, patients, and ultimately the entire community. Expanded parental leave would keep nurses at the bedside. Studies show that companies that offer robust paid parental leave increase not only recruitment, but also retention. In a workforce that is already in crisis, we need to keep as many experienced nurses at the bedside as possible. This issue is deeply personal to me. When I had my second child, I experienced firsthand how difficult it was not having enough paid leave. I had exhausted all my paid time off during my first maternity leave, so that when our second child was born, I had not acquired enough PTO, and I was forced to choose between continuing my leave unpaid or go back to work early. I was fortunate enough to have money saved that I did not have to return to work early and was able to finish the leave unpaid. As we know, this is not the reality for most families in Allegheny County. With rising gas, grocery, utility, and housing prices, many mothers and fathers are struggling and have to return to work to make ends meet. Instead of spending those early months fully focused on bonding with their baby and recovering, they have to worry about finances. No parent should have to experience that kind of stress during such an important time in their lives. I would like to have more children, and my spouse and I are worried about how we'll handle all the costs if the parental leave policy isn't changed. This is why I am proud to stand with this coalition, fighting for paid parental leave for Magee Nurses and for all working families in Allegheny County. We have to remember that paid leave is not a luxury. It is essential for the health of our babies, parents, healthcare workers, and families. Together, we can build a community where every parent has the time they need to heal, bond, and care for their children without sacrificing their financial security. Thank you.
All right, last but certainly not least, I'd like to introduce a true ally in this fight for paid parental leave, County Council Member Lissa Geiger-Schulman.
Thank you. My name is Lissa Geiger-Schulman. I am on Allegheny County Council representing District 3, which is the northern communities of Allegheny County. But of course, the work that we do on County Council affects our entire county. And I'm going to speak very briefly just to two aspects, two experiences I bring to my role on council. I'm only a few months into my first term, but I bring both the experience as a mom and a working mom, and I bring the experience as an advocate previously for early childhood and maternal and child health. And I'll speak, that's work that I did prior to being elected, and because our county council is full-time, I continue that work now. And what I've heard in that role as an advocate has certainly been
Go ahead.
has certainly been many of the stories like what you've heard today. I've been in everything from press conferences to legislative events to legislators' offices to families' living rooms, and heard the stories from folks who had to go back to work too soon, who needed to pay the bills but had a child in the NICU, or a child who was sick, or themselves suffered complications and were still caring for themselves, trying to figure out how to breastfeed, how to pump, how to do all the things that are brand new to moms, while also getting the income they need. And it's shameful. It's unacceptable. I have been telling this to colleagues and others in elected roles for years, and I'm thrilled to now be in a position on county council where I can have an impact myself and make sure that we get that change. The second piece I wanted to say is, as a working mom myself, I have experienced having to go back with this one, having her next to my desk and a playpen and a bouncer because childcare wasn't available. We know that infant childcare is incredibly expensive if you can even find it. The wait lists are incredibly long, and if we want to see more women in our workforce and remaining in our workforce, there have been dozens of meetings I've been to just this month talking about the need for growth in Allegheny County. I agree with that, and if we're going to get that, if we're going to grow our economy, grow our jobs, we need to make it a reality that women can be retained in their jobs through paid parental leave, and 12 weeks of paid parental leave is what we have to demand. So in conclusion, I want everyone to know you have allies in your county government, not just myself, our executive, many of my colleagues on council are excited to do everything we can. This week we'll be working on a resolution in support of state action, which would bring this change to everyone in Pennsylvania. And in absence of that, we will absolutely do everything we can to act at the county level and work with all of you to bring 12 weeks of paid parental leave to every employee in Allegheny.
Hear, hear.
Thank you so much, and let's get it done.
All right, now we're going to wrap up the speaker program and start our Mother's Day lunch and social, which will be followed by community canvassing to gather signatures on our support petition. So please sign our petition now. It's at parentalleaveforac.org, for FOR, parentalleaveforac.org. for ac.org.
Everybody go to their tables.
And everyone can go to their tables. And there will be, I think, one more announcement once we're seated, and then we will eat. All right.